important aspect is the brain of student, the brain structure is the real confluence for education, their success and mental health. That is one reason why हम ये कहते हैं कि छात्रों का जीवन बहुत महत्वपूर्ण है. It's very important because their personality is growing. And if it is about more than 50% mental disorders show their first sign and symptom in the age of 14 and 17 years. So one has to be very keenly observing their life. The parents have a responsibility to keep a concentration and focus children, adolescents, and young adults about their symptoms, about their life, any changes in their sleeping habits, their behavior, etc. Because that may be a normal part of their growth, as well as it can be first sign of coming up mental health problem in future. That's what the research shows us. So this is one reason why students' life is important. The second is, if you see the nature of problem that students go through, whatever research has shown, and you see around yourself, everybody talks about बहुत तनाव है, बहुत stress है, a lot of suicides are taking place. In India, about 13,000 students, unfortunately, they die due to suicide, and about lakh and about 10 times of this number, they attempt, they are taken to the hospital and they are treated, they are saved, and they come back to the mainstream of society. So such is our such when you start thinking, why is it happening? That's a big question. It is your responsibility as well as our responsibility to think, why is it that students are getting more depression, more anxiety, and even more suicidal ideas? So these are the questions that we need to think about, we need to talk about, and repeat for others that if somebody has faced a kind of experience or negative experience or adverse event, adverse experience in childhood or even in adolescence or even in adulthood, how do you get over the feelings, the emotion, and the memory of these events? This is the field of trauma, which is very important, and a lot of research is going on. And it is one factor which is important, which precipitates a mental health condition or stress. Whenever such people face any other stress, they develop more depression, more anxiety. Even if they don't develop anxiety, depression, etc., the mere impact of this trauma or impact of experience is very much troublesome. People develop a kind of experience of nightmare, getting no sleep in the night, or repeatedly getting up the flashbacks of the event, suddenly becoming depressed or becoming very overwhelmed, or start having feelings of that they want to cry or feel more agitated, angry, etc. These are the symptoms, but the main issue is their inability to overcome the experience of trauma which they have. Now, there are certain tips to that students must do. The first is that you have to make an attempt to overcome the experience of trauma. What I mean by it, that you have to talk about it. Whether you go to a psychologist or you go to a friend or you go to your parent, should not be hesitant that it was so nasty or a bad thing to talk about and you have not talked about it for years together. And they live with this experience of trauma without speaking. One thing is sure, unless you speak about this problem, you will not be able to overcome the trauma of this or such events. So my first suggestion is that if anything like that has happened in the past and you are experiencing these symptoms, it is important to share your feelings with someone you trust, with someone you believe will be hearing with patience and giving you some advice what to do. You see, talking is a psychological treatment. It is not just conversation. When you express yourself, you express your negative feelings, you get more solace. You talk once, twice, thrice, many. See, that's what psychologists do in the profession. That they talk. Doesn't matter. They talk professionally in a different manner. That's a different issue. But the whole thing is around conversation and revealing and getting some suggestions and feeling inside your mind that the pressure is off. So my suggestion is, we will talk about it further. My suggestion is that if anybody, you or anybody is having such flashbacks of the memory, first thing is to talk, find out the person with whom you can talk. And if you do not have any such person, please go to your college counselor or any school counselor and discuss the issue. More you will talk about in about 5-6 sessions, one is generally becomes a different person. Have I have you heard me? Is that anything else you want to comment? It's for the individual to understand that you need to do what is best in your interest without bothering how will others take it, because when it comes to others, they will also learn from you that you spoke, you are fine. It is very important to speak about your problem, and not even that, speak about problem of others. One thing that I observe, and many of us observe, that today students are highly isolated from each other, even in their friends, group of friends. They they hang out together, but they do not really connect with each other's problem. So a lot of people get depressed, but they do not have a right company, even in their peer group, to express themselves. I think the bondage and the friendship needs to be redefined in today's world, in the university campus. That is one important aspect, that your friends are important. They are the people you can go and talk anything about yourself, and they never pass judgment. They welcome to sort out your problems. There is nobody else in the society who will hear you without passing judgment better than your own friends. So आपके दोस्त जो भी हैं वो बहुत ही महत्वपूर्ण है आपके जीवन में, चाहे वो दोस्त आपके माता पिता हों या कॉलेज के लोग हों। कहीं ना कहीं तो आपको ट्रस्ट करना पड़ेगा। और जब कोई भी इंसान ट्रस्ट करता है, जब आपको किसी पर विश्वास होने लगता है, तो उसका मजा बहुत अलग होता है। इसलिए बॉन्डेज बहुत जरूरी है। आपको ढूंढने चाहिए, लोगों को ढूंढने चाहिए ऐसे लोग जिनमें बॉन्ड अच्छी तरह से डेवलप हो सके। कॉलेज कैंपस की ये बहुत बड़ी जरूरत है। और जो बदला है पिछले कई दशकों में, वो ये है कि कॉलेज में भीड़ होते हुए भी छात्र बहुत अकेला महसूस करते हैं। और जो कुछ आप लोग कह रहे हैं वो उसी का उदाहरण है, उसी का एग्जाम्पल है। और वही चीज आप कह रहे हैं जो मैं कह रहा हूं, एक अलग या दूसरे तरह के शब्दों में। Understood your problem, and let me speak what will help you. Number one, if you have seen any doctor and he has given any medicine, you have to be empowered enough to believe that doctor is a qualified person and he knows it best than your parents. It is all right to defy or deny a parent who is ignorant because they lack a professional knowledge. If they are having questions, should you take medicine, should you not, they can come with you to the doctor and discuss with the person who has prescribed. That's the right way. So if your parents are saying don't take medicine and doctor is prescribed, you should point blank tell them, please come with me to the doctor and discuss why are you saying so. Number one. Second, in your situation, you are not the only one passing through this kind of crisis of what we call emotional first aid problem. Our emotional catharsis, our anxiety about anything. It may be your personal difficulty, relationship, academics, etc., etc. And you have found out somebody whom to talk to, be a psychologist, be a counselor, or a practitioner, or a psychiatrist, or even a friend. Continue to do that. First thing which will stop any suicidal thought to progress is to connect with people, whether he or she is your roommate, or a teacher, or a mother, or father. And if you have no opportunity to talk to, please remember, Government of India runs a helpline. You may be aware, may not be aware, but all colleges and all students must know that we have facility known as Telemanas. You can go on Facebook and see. Its number is 14416, and it is an excellent facility by the Government of India. It is managed by professors, lecturers, psychologists in the Department of Psychiatry in various medical colleges, along with a host of large number of volunteers with them. They are doing excellent job, and they have received more than 1 million phone calls so far. So if you are confused or you don't find anybody to talk to, please dial 14416 and discuss with them your issue. One should not delay the opportunity of intervention. When you delay, every day is you pass is in crisis. Every day you are suffering. Every day is a bad day for you. So you must take one step forward and dial the number, talk to them, reach out to them without